Okay, so I'm going to have a bit of a review of things with you. So you did have quite a bit of an improvement previously, right? So tell me, let's go back to when this first started, okay? So it was pain right at the base of your coccyx initially, right?
Yeah.
How did it happen? So
Squatting, doing a squat.
okay, so you're squatting and then suddenly it just came on, or what? How did
No, so it was like I felt slightly different for a couple of days. Just when I was in bed, I noticed that kind of, when you just turn like this, I kind of was like pushing myself to turn. And then probably for about 3 weeks, I just had like a coccyx pain, and it was just really sore. And then what happened was, it's really weird because I went to Dubai, and in mid-air, suddenly the pain in my leg just goes, and I'm like, what the hell's that? And then suddenly it drops into my leg. So then it's stuck here, and that's where it remained. So literally, from the moment I landed at the airport, I'm stuck with this pain here, and that just lasted then all the way through until I came here. And I'd been loads of places to get loads of stuff done, and then but it wasn't going. So like, I literally was like driving like this for ages. Do you know what I mean? Because I could not. I had to take time off work, and yeah, it was just a nightmare until I came here. And then, like, even after the first session, it was like instant.
Okay.
And then obviously by the third session, like, I don't have pain. And what's happened this week isn't really, like, it's so minor in comparison because now I've got no pain.
Okay.
So it's just, I just feel like I've always had a bit of a weak lower back, just historically. So I know this is probably something I'm going to have to commit to, like, long term now.
Yeah.
With the weight.
Okay, so there's a few things we have to sift through. Number one is, first of all, obviously, we've made some progress, right? So you're not where you were when you first came in. So you've definitely seen some changes and some improvements with what we've been doing, number one. Number two is that your symptoms are coming and going based on what you're doing, right? So that tells us that this is more of a functional issue, right? Meaning how you spend your time, how you load your tissues, what you're doing with your body kind of week in, week out has an effect on what's going on, which also tells me that if this was a direct result of a S1 nerve root compression like your MRI is saying, then it would be much more likely that your symptoms would be quite consistent and they would be there all the time because the disc isn't going to just kind of pop in and pop out and sometimes compress, and do you get what I'm saying? So there's a lot of things that we have to kind of sift through here. The other thing is that you're mentioning that when you're having treatment things are kind of going well, and then when you don't, it kind of starts switching back and you're starting to feel a bit more weakness and the symptoms are starting to kind of creep back in. So it's telling us that we're going in the right direction, and the consistency of what you're doing, as I said, as you mentioned earlier, is a factor. So if you have big gaps in your treatment and things like that, then maybe you're not going to make the same level of progression. But there's also another aspect, is that there are things that you might be doing outside of the treatment room which are slipping you back, okay? And that's a given, that will happen with everyone. If we're releasing kind of tightnesses and imbalances, and there may be certain things, whether it be sitting, whether it be training, or certain things that you might be doing, which are feeding into the other end of the scale. Does that make sense? Right? So we just need to make sure, in order to help you get over the hill, okay, because it isn't something that you're going to have to do for the rest of your life. It's not like, okay, you're bound to have treatment and this is a diagnosis that you'll have forever. You can get over this, you can fully recover, and you can get back to training, you can get back to feeling strong and doing all those things. Okay, so I want to give you that confidence first of all, because sometimes when you've got that whisper in the back of your mind thinking, oh, now...
I'm writing my life off, honestly. I'm like, I can't do that anymore, I can't do this.
So I want you to understand that can be part of the problem, okay? And sometimes when you get a diagnosis from the GP or from the doctors and they say, oh, you've got a disc bulge, it's almost like a life sentence. It's like, all right, you have this now, okay? But I want you to understand that, in terms of the science and the research, there are, I've seen cases myself where you see an MRI scan where there's a disc bulge, and then you see another MRI scan where there's no sign of a disc bulge at all, right? So they can, you can fully recover from this. And I also mentioned that, the positioning and all these other factors have an impact on the image and what it looks like, okay? So based on your working diagnosis of what we've had with you, there's a lot of kind of muscular involvement as well, okay, and that's kind of what we've been working on and focusing on as well. So we're going to carry on with your treatment as before, and we're going to try and get you back now into just consistency of care, and then I'm going to make sure that you're doing as much as you can for yourself outside. What are you doing at home? What type of stuff are you doing day to day?
At home?
Yeah. So when you're not having treatment here, what are you doing outside?
So I've got a desk job.
Okay, so you're sitting down a lot of the day, or?
It's internal and external, but at least a good just above half of the week I'm not at a desk.
Okay.
So there's that, and then I'm quite an active person. Like, I'm not the type, I don't really sit and watch TV or anything like that. But I'm like, I wake up in the morning, by the time I get home and everything's sorted, I'm going to bed.
Yeah.
So I'm just up, you know,
Yeah.
like.
So you're super active,
Yeah.
okay, but there may be certain parts of your body that are not as mobile as they could be, especially when you're sitting down for maybe 6 to 8 hours a day. Is that right? Okay, and even if you are getting up and you're moving around, you're not stretching out, you're not entering. So there's a lot of opportunity for your tissues to tighten up and things to restrict. Okay, and we need to get, you know, blood flowing. We need to get your nerves to conduct well. We need all of these things happening. And when you're sitting down for long periods of time, that doesn't help that. That doesn't mean that you have to quit your job in order to recover. It just means we need to work on helping you get the right balance. That doesn't just mean coming in for treatments. That means doing what we class as kind of nerve flossing exercises, doing hip stretches, doing all the other stuff in between. And it's just literally what happens is that the analogy I give is like getting over a hill. Right. So each time you're working, you know, you're having treatment, you're stretching, you're kind of edging yourself over. But if you let's say you're riding a bike up a hill, right, and the moment you stop, you're going back down. Okay. So what we need to do is make sure that when you're progressing with your treatment, that you're going one step forward and not 2 steps back. Okay. 1 step forward each week on week. What I would say is in a session, you might find that within a week, you might go 3 steps forward, and within the week, you might go 1 step back, and that's okay. Right? But as long as you're consistent, you will get to the top, and you eventually will get over the hill to the point where you don't have to do as much as you're doing right now. Does that make sense? Right? That's just the way these sorts of things work in terms of people's rehab journeys. They aren't kind of suddenly, okay, I'm better and then I got worse, I'm better and I got worse. It's usually that back and forth. And then when you get to a certain level, that's when we can work on maintenance. That's when you don't have to spend as much time kind of investing into kind of your mobility and all this other stuff. But irrespective of when we get you there, eventually you will need to work on some type of maintenance if you are going to be sitting in a desk-based job. Yeah? Okay. So let's get to it. I wouldn't worry too much about your MRI results. Has that been playing on your head a little bit?
Just, you know what it is because I am so, like, I'm a doer, so I get stuff done. I don't really depend on anyone else. So if there's heavy things to do in the house, I'll just do it myself. And to me, I felt a bit like, oh my God. And because I went back and touched the footstool again, and then it happened, it was worse. I was like, oh shit, what, you know?
Look, what I want to help you do is I want to help you overcome this with your mind as well, okay? Movement isn't going to hurt you, right? So whatever you do, just keep doing it, but just do it slowly, right? Yes, you can avoid lifting heavy loads and those sorts of things, especially at this phase, but you will build yourself back up into that. So I want you to know that there's nothing that you're going to do that's suddenly going to cripple you and paralyze you and make you no longer able to use your legs.
That it happened in the first place, because obviously that, I've never known anything other than childbirth that is like another level, you know? So I was like, it was just really bad, so yeah. But, you know, obviously this is reassuring. So
and also another thing to note as well, especially when it comes to back problems and these sorts of things, the severity of the pain doesn't always equate the severity of the problem. Okay, sometimes you have something which is quite straightforward, but it's the worst pain you can imagine. And then other times you have something which isn't really that painful, but it can be something more serious. And in your case, you don't have any of those sorts of signs. Even the S1 nerve root description you've got, it doesn't match your clinical results, or it doesn't match your clinical symptoms rather. So I don't want to say the symptoms because I don't want to put them in your mind, okay? But what you have on file and what your report says from your MRI scan doesn't match with the symptoms that you have, okay? Which tells me you may have a disc bulge, right? You may have some, and that may have been there long before you even had this problem, okay? But what you've got going on is not necessarily happening as a result of those disc issues. Okay, and like I said, they've done studies where they've taken a random 100 people and they've MRI'd them all, and they gave those MRIs to surgeons, and half of those surgeons were ready to operate on people who had never had any back problems in their life. Okay, so if you put that into context, it helps you understand that the imaging it's not completely irrelevant, but I take that with a pinch of salt, and I try and put the big picture together. You know, you're functional, you're active, you're doing all the stuff that you know, and you can be doing all the stuff that you were doing before. It's just we've got to get over that and slowly build you into it. Okay. The biggest risk I see when it comes to back pain patients is when you lose that confidence and the fear kicks in, and then you stop doing things, and then what starts happening, it's almost kind of a self-fulfilling prophecy in the sense that you stop doing things, you start becoming weaker, and then when you go and try and do that again, or you approach anything near to what you used to do before, you get into a cycle.
Well,
because
at the gym, I was going to go on like the leg press, and then I was like, no. The thing is, I'm a hypochondriac, so I'm that sort of problem. So that I'm the worst person to even see. My doctor's my friend, So she'll just send it through, and like obviously they're just very like their bedside manner is like off.
Yeah.
So but she's obviously encouraged this because she's like she's said similar things to what you're saying.
Yeah.
But
it's just having that reassurance and having that guidance, and that's what we're here for. And I always say to all patients who come here, I say, look, we don't fix nothing, right? We guide you, we help you through the steps, we do some treatment which kind of pushes you along the way, but you got to get over this yourself. You got to understand it, you got to learn about it, you got to implement the things that you need to get you over the other side.
Yeah.
And that's how you're going to get the results. Okay, let's get started with some chiropractic work with you. We're going to do some adjustments for you into your lower back and stuff. Straighten up this leg for me.
Yeah.
Okay, we're just going to position your arms in here, pop this hand here and here. Okay, and just straighten up this bottom leg and bend the top one just here. That's it, perfect. I want you to rest up for me, leave everything nice and relaxed.
Oh my God. Okay.
You're already grimacing.
I know.
Yeah. Okay, nice deep breath in, all the way out. Okay, I'm going to give a little push. Perfect. All right, and opposite side. That wasn't too bad.
No.
Okay, we're going to straighten up this leg. Bending this one, tuck in just there. That's it, hip towards me just here. And we're going to just switch the arms around here and here. And shoulder around. Okay, perfect. Look up towards the ceiling and relax everything for me. Let your body just drop. You're going to feel like you're going to fall for a second. Perfect. All right, let's get you laying on your tummy. Turn this off. Okay, I'm going to pop this down a little bit. Okay, resting the hands here. And I'm just going to give a little bit of a push into your mid-back. Yeah, that's it, perfect. A little push just into here. Nice deep breath in and all the way out. Perfect. Okay, so we're just going to have a feel of things. So how's this here? Okay. And this one here?
Okay.
Okay. And it is your left side, isn't it?
Yeah.
Okay. Okay, so worse in here?
Yeah.
Okay.
Yeah.
Okay. Okay, and I'm just going to check in. So you're feeling it in your hamstring as well?
No, do you know that's past.
Yeah.
It's a little bit tight there, yeah.
Okay.
Oh yeah, that's all. Not that much.
Okay, and this side is all good?
Yeah, that doesn't feel. No.
Okay. Nice deep breaths for me. That pressure all right? Bearable?
Yeah.
Good. Okay, deep breaths.
Not really.
So you tried quite a few things before?
Oh God, yeah.
What have you had?
So I've been to physios, sports massage. Mainly them. I went to an osteopath.
Mm-hmm.
But like literally nothing. I was just popping tramadols. Like
Right.
you know, you can only do that.
For so long, yeah.
Yeah, and out like not during the day. So I had a special cushion I was sitting on.
Yeah.
Honestly, it was just a nightmare.
And did you find any relief in any of those things, or?
None. Literally, like the girl who I normally see here, I was telling her, I couldn't believe when I came in, even just after that first session. Honest, like it was like a 60% improvement.
Yeah.
And bearing in mind that my life for 3 months, I'd literally been in a bad way.
Yeah. That's awesome. So nice deep breaths, okay? If you find this is too strong and you feel like you're tensing up, then I'll ease things up. But if you're able to bear with it and you're able to kind of not tense up, then we're in the green zone, okay?
Tense.
No, you're actually doing really well. Just nice deep breaths, okay? Okay, you're doing really good.
It's like when you hit the side is just so painful.
That's where it's worse, yeah? Okay, so that's an indication that your stretching needs to be focused on your lateral hips.
Okay.
Okay, so I'm going to take you through some passive stretch today to show you how to do that. Just right there, yeah? Nice deep breaths. You're doing really good.
What's the science with acupuncture?
So when you put an acupuncture, so there's different philosophies first of all, right? So acupuncture can be done in the context of what we call traditional Chinese kind of theory. And in that context, it's more on the belief that you're opening up these energy channels that flow through your body, and when they get blocked, they cause illness and disease and problems.
Okay.
So I always say that, you know, when we're doing the technique, it doesn't matter what philosophy you follow. But when you practice it from a kind of, how can you say, like a medical perspective, they call it dry needling. So they don't call it acupuncture, they call it a different word. Technically, you're doing the same thing. But the science behind it is when you have a muscle which is in spasm or really tight, it's in kind of threat, so it's contracting and protecting, as we discussed is happening in your case.
Yeah.
I'm just going to pop this one in. That feel okay?
I didn't feel it. I just felt you tapping it.
That's it.
Oh, now I can feel it.
There we go. That's all?
That's okay.
Yeah, that's all it is. So yeah, what happens is the muscle's contracting, right? And when it's contracting, if we put a needle in it, your body recognizes the needle is something foreign.
Okay.
And the body's response to anything foreign is to attack it.
Okay.
And the way that it attacks it is by sending its kind of defense mechanisms, which is all your immune system basically, from your bloodstream. So the way to attack it is by sending blood supply to that area, so that your immune system can start responding to whatever's there.
Okay.
But when you have a muscle spasm and you have tightness in the muscle, your body's kind of, we're putting it in a bit of a dilemma. It's either like keep the contraction and prevent blood from kind of going into the area, or relax the muscle and allow the blood supply to get there to attack the needle.
Yeah.
Does that make sense? So it's kind of like almost tricking your body into causing that muscle to kind of release the spasm. For some people it works really well, and you know, you put the needles in there, the body responds straight away, and you get a really good kind of relaxation response. For other people, and sometimes it is in the mind a little bit how you feel about acupuncture. So if you're really not good with needles, and you're really kind of you're focusing on it and you see it as a threat, or you feel of it as a threat, then your body can sometimes do the same. And then when the needles go in, you tense up and you don't get the same benefit basically. So it is kind of what you expect has an impact on what you experience with it in terms of your physiology.
Well, I mean, I've looked at it in the past, and I am quite open-minded too. I mean, I can't even feel that. Like, I can feel it I can feel a little bit of pressure afterwards, but I don't really feel any of them really. It'll be interesting to see, because I have looked at it before.
Yeah. Again, all of this is like acupuncture is like pretty harmless in the sense it can't cause any problems. Even if someone was to hit a nerve or anything like that, it doesn't. The needles are so fine. Yeah. It doesn't cause any problems. I can remember when I was studying acupuncture, and we were talking about the possible risks and what could go wrong and all the other stuff. And the doctor who was teaching it, he turned around and he said, "Listen, when there's a newborn baby, to find out if they have problems sometimes they need to do certain checks in medicine, right? Yeah. So he said what they do is they get this big fat needle, and they take the needle, they go straight into the kidney, and then they suck out from the needle, and they aspire a little bit of the kidney out from the needle, and they pull that out, and that doesn't do anything to the baby. Wow. It's completely like, it doesn't really cause any problems. There's a little bit of blood in the baby's urine, and they take a biopsy in that way. They take
because of how fine the needle is?
No, so this is what he was giving an analogy of, like, that's if you imagine that is like pretty extreme, and even that doesn't cause a big problem. So he's saying these needles, in contrast to those types of needles, those needles are like big fat needles which can suck a little bit of the kidney through, whereas he was like, these needles are so fine and so thin. He said, you know, even if you go through vessels, if you go through, and obviously we're not planning to do that, right? But even if you go through nerves, you go through all of these things, the needles don't disrupt the tissues, they don't damage anything.
I mean, I have Botox and everything, I literally don't have, like, jack me up, it's fine, so
Okay, cool. All right, so we're going to leave you relaxed with these. You all good?
Yeah, fine.
Cool. All right, so I'm going to let you rest for a couple of minutes, and then we'll pop back in, okay? Remember I said, from what we can feel, your lateral hip is really what needs that stretch and that attention, okay? So have you done the pigeon pose stretch before?
No.
No? Okay, so I'll show you how to do that. That's going to be a really important one for you.
Okay.
And I want you to try and get doing that as much as possible. What stretches have you been doing?
Just like my own made up ones at home.
Oh, really, yeah?
Yeah, just like that one.
Okay, so I'll show you. So a couple of ones that you can do. The first one is I want you to straighten both legs. Okay, and I want you to lift your, hang on a sec, which side? This leg. Yeah. You're going to lift it straight up, as high as you can go. Okay, and then you're going to just drop your leg to the side. Okay, and let the weight of the leg just create that stretch. Okay, and you should feel that stretching from your hip all the way into your back.
Yeah.
And I want you to just literally let that drop down. Now I know it might feel uncomfortable, but you will get to a point where you'll eventually kind of enjoy this stretch and it'll feel good and it'll be relieving. But in the beginning, it'll feel a bit uncomfortable and it'll feel really kind of just tight basically. Okay, so I'm just going to help stretch that out. Nice deep breaths. Okay, so with breathing, really important thing is you need to, with stretching rather, really important thing is you need to use your breath with it, okay? So nice deep breath in. Okay, and as you breathe out nice and slowly. Okay, and then we're going to stretch as you breathe out. Okay, to make sure we don't tense up into the stretch. I don't want you to fight the stretch. Okay. I want you to just get into that position, feel the tissue stretch. Okay, we're going to turn this way now. Yeah. Okay, and this is mimicking what you're going to do at home, which is like the pigeon pose. Okay. Stretch. Okay, so I'll show you how to do that yourself. But this is now just stretching that rotation or getting that rotation stretch here. That feel okay?
I can really feel it here.
Yeah. Okay, perfect. Nice deep breaths. Okay. All right, it's good. There's 2 stretches that I want you to do. So I want you to stand up for me. And I'm just going to show you. So pigeon pose, what you're going to do, pop your foot up onto the bed. So I want you to pop it up like this. That's it, perfect. And I want you to bend forward at the hips. So try not to curl your back. I want you to bend forward at the hips. So you're going to go from here and you're going to lean forward like that. Okay? That's it. So drop your leg back and I want you to lean your body forward. And try and make sure that that's happening at the hips and not at the back. Can you feel that?
Here.
Exactly. That's exactly where you want it to feel. Okay. And what I want you to do with here, I want you to literally just reach out. Okay. Stretch out as far as you can. Nice deep breaths in. Okay. And with this pigeon pose stretch, you can follow it to the T like I'm saying to you, or you can do what I would prefer you do, is you play with the stretch. Okay. So what I want you to do is literally move your angle around now. Okay. So we're going to turn this way a little bit. Okay, so we're going to change to kind of 45 degrees and you're just going to literally stretch your body out. Again, trying to push your hips backwards so you're tilting and tipping at the hips. Okay, can you feel that happening?
Yeah, I can feel it, yeah.
Okay, and you can come all the way around. Okay, so you want to come now to this angle a little bit. Okay, and then all the way over this way as well. Okay, so you're going to just alter those angles as you go around. You can do this on the floor. Can you imagine how you do this on the floor? The leg straight back out and you're going to just turn this inwards like that. Okay. And again, just playing yourself out and just getting a good stretch there.
Should I do it?
Yeah.
I can feel it proper pull it in, yeah.
Yeah. So the areas where you feel it hurt more, where you feel it pull more, are the areas where you actually need to stretch. Okay. So sometimes you might think the opposite. You might think, oh, I don't like that, so I'm not going to do that. Okay. But obviously, if it's excruciating, then I want you to come back from it. But if it's a feeling that you feel like, that feels a bit uncomfortable, but I can...
It's almost nice. Like,
exactly.
Pain,
exactly, yeah. So you'll get to a point where it will eventually feel nice, okay? In the beginning, obviously, you're in spasm and there is pain going on, so it's going to be a bit uncomfortable. But I want you to just keep challenging those barriers. And each time you do this, I want you to try and just push that barrier a little bit further.
That's fine.
Okay? Yeah. So this one, and you can also do one, so take a seat for me, because obviously this will be hard to do if you're at work. So I want you to have a seat facing this way. And I want you to just pop your foot up onto your knee like this. Sit up nice and straight, so your back is nice and flat. Then you're going to hold on to that knee. And you're going to lift the leg up towards the opposite shoulder. But what I want you to avoid doing is leaning back like that. Okay, so I want you to keep your body upright. And you're going to lift that knee up so your knee is coming close to your chest. Yeah. Okay, and as you do that, I want you to rotate the opposite way. Okay.
So this way for me? Or is it this way?
Yes, towards me. Yeah.
Okay. Yeah,
can you feel that?
Yeah.
Okay, so these are the 2 stretches that I want you to literally do as much as you can.
And am I doing it on both legs or just the one?
You can do both. Okay. Yeah. When you have the type of issue that you have, it can actually switch sides. Okay, so you can have it where it gets completely better here, but then it starts tightening up on the other side, and that's simply because there's an imbalance. So the muscle spasm then starts happening onto the other side. Okay. Yeah. So if that does happen, don't be too surprised. No. This is just part of the process. You will get through this. You will get better. Yeah. Everything else that we talked about in terms of your activities. Do what you normally do, just take it slowly.
Do you think I shouldn't do any weights at all at the gym, or do you think it's all right?
I would say if you want to do the movements, I would say do the movements. I wouldn't say to load it up too much, because when you load it up, you're going to be condensing tissue and you're going to be tightening things.
So you know, like when you, I don't know what they're called, you know, like when you do the kind of like leg like that or leg like that, that's okay, just with minimal weight.
Yeah, I would say doing that and just getting your range of motion is fine.
Okay.
yeah, and actually be helpful. If you're loading the tissues where you're having to contract them quite a bit, I wouldn't say it's the worst thing, because sometimes I have people who come here who are athletes and they're training and they still need to go through rehab. So I don't stop them from training, but I say to them to recognize that you can tighten things up by doing that. So remember we talked about the balance, about kind of working on loosening, and then there's certain things which tighten. That is going to feed into the tightening. Okay, but I'm sure you're going to be good with it. If you're just consistent with this, you're going to get through this pretty well. Okay?
Yeah.
All right, I'll let you get changed up and just come on through when you're ready.